Hello, my name is Sean. I'm going to be your nurse today. How are you doing? You're doing good? Okay, cool. Can you tell me your name and your date of birth, please? Darnell Blahoot, 1952, October 16th. Okay. Mr. Blahoot, do you have any allergies? No allergies to CHG or adhesive tape or latex? No, okay. Do you have any pain right now? All right, no, perfect. So I don't know if anybody's told you yet, but I am going to be doing your dressing change for your CVAD. And so as you may know, your CVAD is that catheter that goes down to your heart that we can give you medications through. And so that dressing needs to be changed every 7 days because it is a sterile dressing, and that could be an easy path of infection. So what I'm going to do today is I'm going to take that dressing off. I'm going to clean underneath it, check for any signs of infection, and then put it all back together. Do you have any questions for me? Oh no, it shouldn't hurt at all. Maybe when I take the actual tegaderm off, the dressing off, it'll be a little bit sore, like ripping off a Band-Aid, but that should be about it. Any other questions, comments, or concerns? No? Okay, well let me know if you do. All right, I'm also going to clean around the edge of this table. All right. And so now that has to dry for 2 minutes. So I'll do my hand hygiene for 20 seconds. And look at that, it has been 2 minutes. So I'm going to transfer over my sterile equipment. Move that. I'm going to open up my dressing tray. So on top, there is a mask. You are going to have to wear this during the procedure because if you sneeze, cough, or breathe onto the insertion site, that can cause infection, and that is exactly what we want to avoid. I'm going to take my sterile gloves out. Now I'm going to drop in the Corvivue. Perfect. I'm also going to drop in the bio patch. Okay, so now I will help you put that mask on. I'm also going to have you turn your head around, okay? We'll go on 3. 1, 2, 3. Perfect. So now I'm going to do some more hand hygiene. Get a pair of gloves on and take a look at the CVAD site. Your central venous access device. Okay, let's take a look. All right, Mr. Darnell, it looks pretty good. I don't see any redness, any swelling, no inflammation. The tubing is not cracked, and it is still at 15 centimeters. So if you're ready, I'm gonna go ahead and start pulling off the dressing. All right, let's do it. And as I'm pulling this off, I'm going to make sure to keep some pressure over the bio patch so I don't dislodge the catheter. Can dispose of that. It'll also dispose of the bio patch. Okay. Yeah, still looks good. Still marked at 15 centimeters. No signs of redness or inflammation, nothing. All right, do some more hand hygiene. So next, I'm gonna put on my sterile gloves and clean that skin, okay? All right, let's do this. All right, now I'll do my left hand. All right, I can dispose of this. Now I'm going to grab the gauze and the CHG cleaning stick. I'll pick this up and clean around. And squeeze this until it pops and then start cleaning. So how are you doing, Mr. Darnell? How's the procedure going? Not bad? Okay, I like to hear that. Well, like I said, if anything becomes uncomfortable or starts to hurt, please just let me know, and I can slow it down and we'll move at your pace. I want you to be as comfortable as possible. I'm also gonna clean up the catheter from bottom to top. Make sure not to pull this line too tight. I don't want to move the catheter out. And there we go. So now that has to dry for 30 seconds. All right, it's been 30 seconds. So now I'm gonna grab my bio patch and apply that. And my Sorbiview. All right, and as I apply the Sorbiview, I'm gonna make a small stress loop and try to get the blue bio patch as centered as I can. All right, that looks good. Try to get the air out, make it nice and smooth. Now I can smooth this out. I'm going to grab the bottom half of the Sorbiview. Put this underneath the catheter and apply. I'll do the other side. Perfect. Not too bad, Darnell. Right on. All right, now that I've removed all the air bubbles, I can remove the gauze and drop the catheter. And then I will grab the tape and apply it as such. Okay, and drop that. Next, I will grab the hub guard and connect it. This is just so that the connector stays clean. How are we doing so far, Darnell? Awesome, my friend. Drop that. And next, I'm going to sign the date and the time, my initials, and the catheter gauge. I will apply this on the Sorba view. All right, Darnell, all done. It's all taken care of. I can go ahead and dispose of my equipment now. Pull your gown and your blanket up. And there we go. Not too bad, eh? So as I said, we're gonna be doing that every 7 days, just to make sure it stays healthy, okay? Do 20-second hand hygiene. All right, now I'm gonna help you turn your head back around and take that mask off. Okay, well that's been me, my friend. So now, pardon me, I have to go and document the fact that the procedure went really well. You tolerated it well. I have to write the date and the time. I have to write that there were no signs or symptoms of infection, no redness, no inflammation, no swelling, no cracks in the tube, no leaking, and the catheter was still at 15 centimeters. So overall, it went really well. Hope you have a good rest of your day. Bye-bye now.